Welcome, everyone. Thank you for joining us for the webcast, The Integral Link Between Employee Engagement and Mental Health, sponsored by Nivati. This webcast has been pre-approved for HRCI credit. Please be sure to attend the complete webcast in order to receive your credit. You will receive an email from hr.com within 2 business days. It will include the certification credit information. You may also log into your hr.com account and view the credits that you have received. If you have any questions during the webcast, click on Q&A in your webinar controls and type them in. And now it's my pleasure to turn it over to our presenter, Hayley Harris.
Hi, thank you. I'm so excited to be here today and really excited to talk about employee engagement and mental health. My name is Hayley Harris. I'm a licensed marriage and family therapist. I am also a certified yoga instructor, mindfulness practitioner, and I am the lead clinician here at Nivati. Why don't we get some stuff going in the chat and let me know kind of where everybody's from. I always love seeing this part and seeing where people are at during these types of events. California, the Bay Area, Indiana, Virginia, North Carolina, Canada, San Francisco, Canada, California, Oregon, Arizona, Rhode Island. So we have someone back east. Yay. Awesome. LA. Okay. And I forgot to say, I'm based in Salt Lake City, Utah. I'm licensed in Utah and Hawaii to practice therapy. Knoxville, Dallas, Nigeria. Great. Welcome everybody. I'm so excited. Just to let you know, Nivati is an online platform providing mental health and well-being support for employees in 28 countries. I'm really excited to be here and talk about how mental health and employee engagement are linked. A lot of people don't realize this. So usually I have our CEO of Nivati here, Amelia Wilcox. She was unable to attend today, so I'm going to share this story. This is her friend, Shannon, and Shannon gave permission for us to share this story with you all. She is a retired Olympic skier. She's won multiple Olympic medals and has skied all over the world. She's also a mother of 2, a ski instructor, an entrepreneur, and a brilliant public speaker. She thrives on the energy that live in-person events provide and walking across that stage, helping organizations to improve their teams. Shannon and Amelia had known each other for about 6 years now. They work together, play together, their kids are friends. They've seen each other through a lot of things, through thick and thin. Her and Shannon and Amelia were talking one day on Zoom, and they had a couple of their other entrepreneur mom friends, and they were chatting about how things were going and how things were going well and how things were not going so well. Welcome from Alaska. Shannon, who's this amazing corporate team building company, has this amazing corporate team building company run by Olympians. She started to break down into tears and described the heart-wrenching pain of loss she was experiencing from her entrepreneurial dream seemingly had gone down overnight because of the pandemic. Because of that, she shared the weight of the financial pressure she was under to pay for the life she could no longer afford. And because of those challenges, she was also experiencing the hopelessness of a marriage under incredible strain. So not only was she feeling now physically isolated, now she was becoming emotionally and financially isolated and really felt alone in her pain. The stress was so bad for her that she had to get a mouth guard because she would chew on her tongue in her sleep. And this is a picture that she had sent Amelia laughing at herself because she had to wear gloves to keep herself from picking the skin off of her fingers as a stress response because it had gotten so bad and she didn't even realize that it was happening. So this was during 2020, during the pandemic, when things just all of a sudden took a really big turn and we had to make really big changes. Now Shannon she's one of the healthiest, most active, inspiring, optimistic people that Amelia's ever known. And she just smiles. She's always smiling. She had no signs or symptoms of mental illness or any history of a mental disorder in her past. She would exercise, she would eat right, meditate, get enough sleep. She was doing everything that she was supposed to. And she was still struggling with her mental health right now, more than she'd ever experienced in her life. Shannon wanted us to share this story because we here at Nivati, mental health practitioners, along with Shannon, there should be no shame in what she's experiencing. It's been a common human response to the unprecedented amount of stress that a lot of us have experienced over the last year and a half. And to say that pretty much no one has been impacted by this type of stress in one way or another. In fact, Shannon's story is not unique in any way. Right now, this was a poll done, I want to say this poll was done at the end of 2020, but 41% of adults are experiencing a diagnosable mental health condition. So that means, even here, let's see, there's 124 of us. So at least almost half of us are experiencing symptoms that could qualify us for a diagnosable mental health disorder. But I also like to tell people you don't have to have the diagnosis of a mental health disorder to be struggling with your mental health. It has impacted everybody. And it's no wonder why. Looking at the state of what's going on in the world. These numbers are from the American Psychological Association and represent the percentage of people feeling overwhelmingly stressed from these issues. So we have things, COVID fear, around 75%, 78%, remote work, social unrest, economic uncertainty, and political polarization. So, but if we think about pre-COVID, we were already in a pretty difficult place with our stressors that we were having going on. Things like mass shootings, climate change, immigration, sexual harassment and assault, opioid and heroin epidemic, as well as the suicide rates. And for many of these things, I would not be surprised if they have even increased in the last year and a half, just because of people's way of trying to cope with all of this stress. So we were already on the verge of a mental health crisis before COVID, and COVID just lit that on fire, put a spotlight on this huge issue that we already had. We had all of these stressors pressing on us before, and then COVID hit. So we had all these stressors plus all the stressors that this pandemic has added. And so it's no wonder why so many people are struggling with their mental health. And I always want to tell people that you are in no way alone in these struggles, but also keeping in mind that means that our employees are also struggling with their mental health. So let's talk about what mental health is. I think it's very important for us to understand. And I am kind of curious. So a lot of companies, and I do HR anxiety groups. Nivati offers those usually about once a month, and they run for 4 weeks. And it's been really interesting to get to hear people that work in HR and how these companies are understanding of and supporting the employees' mental health. It is very important now more than ever that employers are doing something to help their employees with their mental health. So what is mental health? Well, one of my favorite explanations is from the World Health Organization. It describes this. Yes, Bridget. Hello, Bridget. Not understanding and supporting it well enough. Because yes, it's one thing to understand and, be like, oh yeah, it's a problem, we need to do something, but then not supporting enough and not doing enough is going to make a really big difference. And you'll see it's going to increase the employee engagement. So mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her own community. So mental health has to do with our mental and emotional state of well-being. And I love in here, it says how we can cope with the normal stresses of life. We already were kind of before pandemic, some of those stresses before were not very necessarily normal, right? And then COVID hit, and this has not been normal stress. This is not a normal stress. This is, once in a hopefully not even lifetime. I mean, this kind of thing happens, the last one was 100 years ago. So this is something that people don't know how to live through. And so it's understandable that we are having such a hard time coping with it because it's not even the normal stress. But our mental health will significantly impact our life in various ways. Various factors can also impact a person's mental health, such as a family history of mental health problems, genetics, brain chemistry, or life experiences, such as your upbringing, any trauma experienced, or significant stressors. And this is why mental health matters, because it has such a significant impact on our lives. It affects our emotions, the way that we feel, and how we manage those emotions. It impacts our thoughts, the way that we think, and what we do with those thoughts, which take us to our behaviors. So it changes how we act and react to what's going on inside of us, as well as what's going on around us, as well as our physical health. It's definitely correlated to disease and our overall physical well-being. Let's see. Joseph said, I like the concept employees supporting their employees, increasing the degree of trust. Yes, we all want to be true to ourselves and have someone. Yes, I love that. That's great. Okay. So, but here's one of the biggest concerns as a mental health therapist and hopefully for employers. We're not just talking about mental health right now during this pandemic. As the APA says here, we're facing a national mental health crisis that could yield serious health consequences for years to come. So we know that even once, pandemic's done and we're in the endemic phase and life sort of, back to normal, whatever normal is going to be after this, we are still expecting, because of what's happened in these 2 years, let's say, we're expecting the consequence for about 10 years to be showing that we know that mental health is going to be a problem still for people. And I mean, if we think about it, it's also a fact the developmental phases of people, the normal phases people go through in life. And so it's not just a problem right now, and it's a problem we need to think about for many, many years to come. So why should employers care? What does it matter if your employees are struggling with mental health? And is it really something that employers should get involved with? Well, I mean, if you don't, the answer is yes, for sure. It is a very expensive thing going on right now, which is, no, it's not our top priority, but for a lot of companies, it is the most expensive condition with the highest economic cost in the US. It is even more expensive than heart disease, cancer. It is the most expensive condition. And that's just the economic cost. We also have the things where employees are using the more, because it affects their health, and it doesn't include what employers outside of healthcare in burnout people are dealing with, like caregiver fatigue, substance abuse, overwhelm, exhaustion, and those types of things. Mental health also affects job performance. I work on this a lot with employees and employers, because when people are struggling with their mental health, which we'll talk about some of those main symptoms in a minute, it definitely is going to affect their performance at work. Between absenteeism and lost productivity, we're seeing an average of almost 35 workdays lost per person with a mental illness, which we know from one of those other slides, 41% of the population that has a diagnosable mental disorder. Plus there's things like that we can't measure, things that are like destructive leadership, negative social interaction between employees, and the detrimental effects poor mental health has on the culture and on the morale, which is what we're here to talk about, because it definitely affects the employees' engagement and how they feel about their work. Why else should we care? Well, there's multiple studies out there that show there is lower productivity levels, increased days missed, and less quality of work due to mental health. So we have things like difficulty concentrating. It's a symptom of both anxiety and depression, which results in them being less focused. They're on completing their tasks or getting the job done correctly, also leaving more room for errors in their work. Mental health is going to impact people's sleep. It's also found in anxiety and depression, especially with sleep disturbances, and can result in decreased work productivity, more carelessness, and increased days of work missed. And those with mental health problems are more likely to have the physical issues like we talked about, and chronic illnesses such as diabetes and heart disease, which is going to result in more days missed. So not only are they going to miss more work, but when they're at work, their productivity levels are impacted as well. There's also this study that shows 80% of employees are unengaged right now with their company, with their employer, with their work. We are seeing some of the highest numbers of employees that are not engaged with work. And there is stuff being studied, but it is finding, mental health has a big piece to do with this. Joseph asked, is ADHD an inborn condition? Does that mean like something you can be born with? I'm thinking that's what you mean by that. If I have it wrong, let me know, Joseph. Yes, you can be born with ADHD. It can just be something, the way that you're wired, your brain is wired that way. It's definitely can be genetics, and if someone in your family has it, you are more likely to have it as well. So part of the problem though too with this is 50% of your employees are not seeking help. And we always like to kind of talk about why they're not seeking help, because it is something that is helpful for us to understand. There's the structural barriers such as cost, lack of availability. There's quite the wait list. There's some, shortages in some areas. Because of the wait list, there's not enough therapists to cover all the people that need help, as well as transportation issues. And it's just inconvenient due to maybe location or business hours. There's also the attitudinal barriers. These are actually what affects people. 96% of people are more affected by attitudinal barriers. These would be things like the mental health stigmas that we always are talking about, concerns about employers knowing they're struggling, so that employer confidentiality, ideas around not needing care because they can handle it themselves, clearly, and a lack of understanding of how severe their mental health issue is. And this is a very big issue that we are seeing more and more of. And we want employees to be aware of this so that they can understand, hey, this is something that we could maybe take into consideration when we're trying to understand how to help our employees more. So let's get back to that 80% of unengaged employees, because that's where I want to focus today, is looking at our engagement and our mental health for our employees. When I was preparing for this, I found this number. I was shocked, but not shocked. 60% of employees would feel more motivated if their employer took action to support their mental health. That is over half. Over half of the employees would feel more motivated and be more engaged if they felt their employer supported them. So workplaces need to promote mental health and support those with mental health challenges so that we can reduce the absenteeism, increase the productivity, and the company engagement. We know that there is the way that the employees' mental health is impacting their work, and it is impacting their engagement. Employers could do something about this. Joseph, so the number of disengaged employees is worrisome. Could it be that they don't feel purpose at work, or their managers turn out to be bullies? Most definitely, that could also be an issue. There are many different reasons. I believe if you get these slides, there's the link down on the study, 60% of employees. No, it's the 80% unengaged. On that slide, it will take you to some more studies that show kind of where they test the engagement and what kind of questions they're asking about that. But it could be for various reasons, and definitely some people are not feeling any kind of purpose for what they're doing at least 5 days out of the week, right? And I hear a lot about not feeling supported by managers, or feeling that their managers aren't understanding or caring, and could be bullies. So definitely. So how can we promote and support mental health to help with our employees' engagement? A few things is we need to start talking about mental health. We need to share about it to help normalize it, to reduce the stigma. Stigma is one of the biggest things when it comes to mental health and people struggling, why they don't seek help. And we want to encourage employees to seek the help that they're needing. Company culture, the way that the culture is in the company, like Joseph said, managers, how people treat each other, that's going to also help with their mental health. Having accessibility and options, as well as talking about ways to do proactive care. So we'll kind of go into each of these. The biggest step in normalizing mental health is to talk about it, and it helps to learn about it as well. I'll cover a few of the most common mental health disorders. I'll go through it kind of quick though, because we've got more to talk about. So, and then also teaching about it, like through trainings and workshops. But what really helps, and there's studies out there that show this, is getting leadership to start those conversations, to be involved in those conversations. When we're getting the managers and some of those top leaders involved in this, the employees are going to feel like they're being more understood and supported. And so it's really important to train managers on how to have these conversations, as well as have discussions around the various types of help options. And it's really important that the company communicates that this is confidential, that we're not going to go around and share this stuff. It doesn't go in their employee file or anything like that. As well as providing mental health days. A lot of companies are starting to provide more mental health days, which show to the employee, hey, they care about my mental health and they're doing something about it. So those are some of the ways to start normalizing mental health. So let's kind of learn just a little bit of some of the basics when it comes to mental health, which I'm sure a lot of us know about. Common conditions, some of the most common that we see is depression, anxiety, and post-traumatic stress disorder, or PTSD. These are some of the most common ones that have increased during the pandemic. But we've also seen these other types of issues increase as well, like substance abuse, suicidal ideation, relationship distress, and domestic violence. So I want to just talk about the 3 common ones so that you guys can see those symptoms and see how it's going to be affecting the employee's engagement at work. So in depression, we have things like a diminished interest or pleasure in activities. They just don't want to do things. So which is Joseph's, where he says they don't feel purpose. I mean, that's definitely a depression, can lead to depression. Appetite disturbances, eat too much, too little. Sleep disturbances, eat too much or too little. Psychomotor agitation, where they're moving so fast they don't realize it, or the opposite, moving so slow that they don't realize it. Fatigue or loss of energy. If they're tired, they're not feeling that they have any energy, they're going to have less productivity at work, as well as feelings of worthlessness, and as well as diminished ability to think or concentrate. Those are things that are going to show up in the workplace as well. And of course, in depression, we also have recurrent thoughts of death that can appear. When we're talking about anxiety, some of the common symptoms are excessive worry, restlessness, so having a hard time just sitting still, again, easily fatigued, again, difficulty concentrating, irritability or anger. If people have irritability, short temper, quick to anger, I always look at anxiety and depression. Muscle tension and sleep disturbances. When someone's not sleeping because of anxiety or depression, it's going to be harder for them to show up and do their work and to be engaged. Anxiety is the most common health disorder in the US, but it's also the most treatable disorder. And also, those suffering from anxiety also are more likely to struggle with depression symptoms as well. People with anxiety are 3 to 5 times more likely to go to a doctor's and 6 times more likely to be hospitalized for psychiatric care. So we know that anxiety is going to be affecting employees at work. And then we have PTSD, post-traumatic stress disorder. So this is when there's been some type of traumatic experience that somebody has experienced themselves firsthand or seen or has been on the outside. These can include things, the symptoms include recurrent wanted thoughts of that event, nightmares, upsetting dreams, emotional distress when something reminds them of the event, or a physical reaction when something reminds them of the event. And then, but this is where it ties into that depression, is they'll start having negative thoughts about themselves and hopelessness about the future, as well as difficulty with relationships, because they are more likely to detach from family and friends when somebody is experiencing PTSD. Okay, I'm going to look at these questions. Could trying not to judge others through hearsay, gossiping, and engaging in character assassination help to develop employees to be better and bring psychological safety? Yes, I think that is such a great thing that you have said. Not engaging in the gossip, not judging people. We don't know people's stories. We don't know if somebody actually does have, something going on or has PTSD. And so it's not our position to judge them for those kinds of things. How do people distinguish a mental health condition that requires treatment and just managing situational stress? Symptoms can be so vague or at so many different levels. Burnout is different than depression. Yes. How do we support that appropriately? So generally, a diagnosis comes in when it is interrupting their social life, academic life, work life, home life. Like if it is impacting those things in a negative way, and there's a certain time frame. So depression, they have to be experiencing these certain amount of symptoms for a 2-week period at minimum. PTSD occurs within a certain amount of time after the event, and they're having to experience the symptoms for so long at a minimum. I don't remember them all at the top of my head. I have my book, but there are ways that, and this isn't for us to go and diagnose somebody. This isn't to say, if we are starting to recognize symptoms, like, somebody's not doing good job performance, they're not engaged at work, maybe we can kind of be thinking, hey, this might have something to do, or they're always saying, I'm really tired, I don't sleep well. And we're like, hey, maybe this has something to do with their mental health. Maybe there's, depression, anxiety, PTSD, it's going to interrupt their sleep. They're not getting good sleep. I'm going to share options with them. I'm going to talk with them, which we're going to talk about, and let them know that there's options out there and seek that help. Because yes, burnout's different than depression. And sometimes it's a matter of how long you're experiencing those symptoms. So I hope that helped. Okay, I'm going to get to the other questions in just a minute. So we're going to talk about how do we support an employee, which is that part where like what are we able to do? Some of the best things that we can do is understanding the signs and symptoms. It's important that we understand, like, hey, this could be something with their mental health. And that's why I like to talk about those common ones that come in. Creating that safe and confidential space, knowing that they can talk to you in private is very important for employees. Encouraging them to share their feelings, using good listening skills, and we're going to talk about this stuff a little bit, learning what to say and what not to say, taking care of your mental health, providing employee education, so making sure employees know that there's helping them to learn about mental health, how it's showing up for them, as well as their options, and reducing workplace stressors. So here is a list. I'm not going to go through all of them, but things on what not to say and what to say. So a few of things that I like to point out on what not to say is lots of people have it worse than you. Or let's see, look at the bright side. Because when we say those things, we're diminishing a person's emotions and what they're experiencing. Somebody is always going to have it worse than us, and somebody's always going to have it better than us, right? That's just how it is. So, but what a person is experiencing in that moment is real and it's happening, and it is causing them some type of distress, and they need some type of support. That's what's the important thing that we want to look at. And so on the other side here are things that you could say to them to help them know that you are there to support them. If you feel okay with it, you can ask, I'm here to talk if you ever want to, or when you're ready, what can I do to help support you? I think that's such a great answer. It can be so helpful for people because they are kind of scared to ask for help. Things like, how are you coping? Or I wanted to check in with you. I've noticed, you've been distant more, or I've noticed you've been tired a lot. Like, are you something going on? What's concerning you? I love this one. Has work been stressful for you lately? I'm guilty of this. I don't often share when I have a lot going on with work and I'm really stressed and feeling overwhelmed, because I'm a type that I'm like, I can handle this, I can do it. So it is helpful for me when my supervisors ask me, hey, is work stressful for you in any way? What can I do to help? It's always such a great answer because it just opens that door for me to be able to talk to people about it. Some mental health best practices that I always have on here as well is educating yourself. And you can share these with the employees as well. I was kind of reading Heather's comment, we're not trained professionals that can diagnose, correct. Pay attention to the behaviors is really important, and promote, I love it, promote the employee assistant program and other tools that could lead them to get that help. Yes. So here are some mental health resources, and there's so many out there, which is something I love these days, that you could follow and encourage them to check in with as well. You are also setting an example in HR, and managers and leaders. Show your employees that you prioritize your own mental health by having very clear work-life boundaries. This could look like not responding to emails on the weekends or outside of work hours. I hear that a lot in the HR groups is I feel like I have to respond because my manager sent me an email, so I have to respond. So if we don't even put that out there, then it makes it a little bit easier. for the employee to not feel like they need to respond. And I mean, if you feel comfortable with it, one of the best options is to start talking openly about your own mental health, your challenges, wherever you feel comfortable in that place. Establishing a meditation time for your team. This is one of my favorites that I love watching companies do. If you're working in person, you can meditate together, quick, hey, we're going to have a 5-10 minute meditation at this time today, everyone come in. Or you could do it virtually as well, have a Zoom call where everyone does their meditation together, or challenge the employees to do it on their own and discuss it during, and this is where we get that engagement, is by encouraging the employees to do these things and then having discussions about it and having like kind of those open conversations. And we'll talk about that as well. And then lastly, asking the employees how they're doing, truly how they're doing, having one-on-one time. And that's where you can say things like, hey, I noticed some things are going on, or is everything okay? Is work stressful for you? And that's that opportunity that you can have for that time. Other strategies to increase engagement. I'm going to check the chat and check the questions and comments. Sometimes people are engaged in other duties at hand and are supposed to remain engaged in other activities. Does it really work, or could be advisable to create a conducive environment? I don't know if I completely understand. Sometimes people are engaged in other duties at hand and are supposed to remain in other. So like having too many things to do. Is that what you kind of mean by that, Joseph? If that is one task at a time, and I teach people, be clear about your boundaries. Say, I can't do that right now. I'm going to be working on this, and I will get to that later. And an employee, this is where learning about your mental health is really helpful too, to understand, like, I need to set those boundaries for myself. And yes, sometimes employers have unrealistic demands, and that is really, really tough, and where I wish employers would be more, understanding of what they're asking their employees to do. And some employers do not support a healthy work-life balance, and that is really unfortunate. And what that's going to do is decrease that engagement of the employee, most likely going to go elsewhere and look for another job. Okay, so increasing engagement. This is one of my favorites, one of my bigger ones that I like to do. I'm also on the culture club here at Nivati. So company culture, because it is the culture that ultimately reduces the stigma, and it empowers employees to actually use the benefits without fear of retribution. So when the culture in the company, which is kind of what you guys are talking about too, when the people in the company, the leaders, HR, when we're, talking more about it and having more of a positive company culture, it's going to help reduce the stigmas. And people, I think somebody mentioned, talking about the EAP programs, the insurance options for mental health, it's going to help people feel like they can go get that help. So some ideas for building community, having forums and conversations. So creating a space for employees and teams to talk to each other, to share their experiences or their struggles and get some advice. And then also maybe having those in-person or online meetings to have some of those conversations. It can be one-on-one, it could be your team. Nivati, our admin teams all meet together, but then our other teams, we meet together, and it's not always just about work. Sometimes it's just sometimes the struggles that we're going through, we leave that open for people to feel comfortable to be able to talk about those things. And then that helps us understand, hey, I could help with this, or hey, talk to me if you need something. And having a space for the employees is so helpful. Which I'll talk about on the next slide, how we can do some of those things. Having work-sponsored events, company events to support employees and families. things like, I know companies, Halloween was just, the other day, companies had, bring your kid, they can do trick or treating at work, dress in the costume. At Nivati, on one of our technology platforms, everybody was sharing pictures of their kids or themselves dressed up or what they did for Halloween, because we really want people to know that we support them with their life outside of work as well. And then company programs, things like those group meditations that I mentioned earlier, and self-care incentives and self-care programs to support people's self-care, which we're going to talk about too. So some ways that some of the systems that we can use to create this company culture to help people feel more engaged and involved. These are some that we use here at Nivati. Let's see, we have Volley. It's a video service to cut back on meetings. And it's like Snapchat and Slack put together. So we use that. That's one that we like to use for company culture ideas. We shared, hey, share some of your favorite fall recipes or what you guys like to make with your families. And then sometimes we'll ask questions as far as like, hey, what are you doing, for your self-care this weekend, or what did you do for your self-care this weekend? We'll have those kind of discussions as well in our on Volley. Having those one-on-one meetings that I have discussed, it's a great way for employees to feel heard by their managers. And those that feel heard are 4.6 times more likely to feel empowered to perform their best. So it's really important to have those types of meetings. Slack, I think a lot of us know what Slack is nowadays. It's very efficient for us to communicate quickly, as well as put in work-life boundaries. I turn my notifications off, 5 o'clock. I don't get volleys, I don't get Slacks. I turn off, I put in my boundaries. So I'm not getting messages on my emails and my phone. So having those types of things can be really helpful, as well as allowing flexibility. A lot of people will increase their engagement when they feel that there's the flexibility in their options, letting employees work when is best for them. It can be really helpful. Do you have any recommendations? Let me think about that, Morgan. I want to get through some more of this, and then if I don't get back to you, I'll be sure to answer in some way. So other options for making sure that we're supporting and understanding of our employees' mental health is providing easy accessibility. So to get the help that they're wanting, so we need to make it convenient. Things like mobile apps, digital solutions, email and chat options. There are a lot of those kind of things out there nowadays. My mind just went blank. Talkspace, right? I think it's Talkspace. It's just a chat one, maybe. There's a chat one that people like to do, because everybody has different preferences on how they receive this help. So it is good for us to think of the various options that are out there. Consider company paid therapy options outside of insurance, because insurance can be so difficult and limited on the choices for in-network. It is a very big complaint I hear from a lot of clients is how it can be difficult at times. I know therapists that take insurance have a wait list of possibly 3 months out right now. So it is really difficult. So it's nice if there's other options for them. Giving direct access and eliminating the middleman. I know in some EAP, not all, some EAPs, it can be difficult. I actually had someone the other day that came on with me for a session. They're like, oh, I thought this was just to try to help find a therapist for me. Like they were thinking they had to go through all those steps. And we're like, no, this is easy. You sign up, you're with a therapist right away. So when we eliminate that middleman, it really does help. And another hard thing about some EAP programs, EAPs, is setting hard limits. Some say you get 6 sessions and that's it. And that is extremely difficult for some clients because some of them are needing a lot more help than 6. So sometimes they have to stop or they have to transfer to another therapist to use their insurance. They're on that wait list for 3 months. and it can be very detrimental to their mental health. Other things like providing more options, because mental health care is not a one size fits all. Everyone's going to have different things that help them. So in-person sessions, there's teletherapy sessions, pre-recorded mental health videos. We have a lot of those on our library that some of the employees use those that never do therapy. And then the ones that do therapy don't look at the videos. It's kind of interesting because we've seen everybody's using everything so differently. And then we have people using downloadable resources and articles. And there's a lot of that kind of stuff that can be found online on some of those sites that I mentioned earlier. Coaching can be options. Some people are really scared because of that stigma around mental health. So having coaching in there can sometimes be an option for people, especially, you're talking with an employee and they're like, I don't want to do therapy. I don't feel comfortable. You can suggest, well, what about some type of coaching? Would you be open to a coaching option? And then also having those phone and text crisis lines. There are hotlines, there are, the suicide hotlines, the help hotlines, there's domestic abuse hotlines, parent struggling hotlines. There is a lot out there that people can use if they're not wanting to do in person or if they need something immediate. So there are a lot of different options that are helpful for employers to be providing to the employees to give them a higher likelihood that they're going to seek help because we're making it easier and providing more options. The last piece is the proactive care. So when we're talking about mental health in the workplace, it can be so helpful to support proactive care so that the employees don't get to a place where they are completely, dysfunctional and can't be at work and sometimes have to quit. So proactive care are things that we do to help take care of our mental health, to not get to that place where we are in burnout or we are in stress mode or overwhelm. A lot of these include things that therapists would suggest for you when taking care of your mental health. A lot of people don't realize that we do all of these types of things in some way when helping clients with their mental health. So there's things like in therapy, because we process and work through things and talk. There's things like coaching, breathing, meditations, exercise, nutrition, fitness, sleep, and self-care. So these are things that it's helpful for employers to be aware of in, promoting this type of activity, these types of activities to help a person with their mental health. People don't understand that supporting this type of activities is going to be supporting a person's mental health. It's really important that we promote self-care. Self-care, it's the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. I love this explanation because to promote health, prevent, and maintain health. So self-care, I know people think self-care is just, going to get a massage or a pedicure, which, yeah, that can be self-care. But there really is a lot more to self-care that it is important for companies to be talking. What are you doing for your self-care? And that's why sometimes we have those kind of comments in our company culture where it's, hey, what are we doing? What are you guys doing? What do you like to do? What are the activities that make you feel happy and bring you joy? What are you doing outside of work? Having those conversations is going to encourage the employees to do those things and say, hey, these are important too, not just work. So here's some ideas for self-care that people don't often think about all the time. Your diet, having a healthy diet, is a part of self-care. Regular physical checkups, going to the doctors, going to the dentist, exercise, practicing healthy sleep hygiene, take time for relaxing, having a healthy support system, keeping a regular schedule, doing things like reading, journaling, listening to music that you really like that makes you happy. I actually just got out of a staff meeting with other counselors that we talked about, how do we do those work-life boundary and turn off work when we're going to home. I work from home, but these other counselors work in the offices, and they were talking about how they use their drive home and they crank up the music and they just jam out. And one of them was like, I probably get all the weirdest looks in the world, but she says that, that's a form of her self-care. That is something she's doing that just brings some joy to her, so that then she can go into her next activity, not with all this heavy stuff from work. Things like turning off your phone, that is a form of self-care, giving yourself that break. We are constantly getting information, and sometimes we just need to put it aside. And that's part of creating healthy boundaries. Having healthy boundaries with people, things, work. It's really important to look at those with self-care. Doing things where you decompress. So, if you want to sit in front of a TV for 2 hours and it's just something you want to enjoy, then just enjoy it. That can be a form of self-care. Because I say a lot of self-care too is doing things that you enjoy doing, things that make you happy, making sure you're carving time for you to practice that self-care. Okay, so that is everything. I want to make sure I get any questions that you guys have. Yes, if you guys have any additional questions, please let me know. Any recommendations that have a tight budget? I'm not sure if how much those systems are, those technology systems that I mentioned earlier. I don't know the cost on those. I want to say that we've also used things, other systems that didn't cost anything. I want to say Marco Polo is an option. You can upgrade. I think Volley you can upgrade to a paid version to get more options. And if you're really limited, you can do, group emails where people chat about different things, and you have that create like a forum. Gmail has the chat box option. I do that with another company where we have different types of chats. And it's just sometimes a venting place. We just vent about things that are frustrating to us in our job that day. So it's great to have those different types of things. How would you handle an employee that needs to get mental health and doesn't acknowledge it? That's a really tough thing to do. I'm not going to lie, Kimberly, because I come across that myself with people that need the help. And that's where it gets to a point that we can only do so much, and the rest is up to them. But I would continue to keep the door open for them to talk to you, because there are many people that I've heard say, I felt so supported because this person just kept asking me, kept talking to me. And I finally felt like it was like, I can go to this person and say, I need to get the help. So I hope that helps, Kimberly. Some health insurance plans offer free tools. Thank you, Heather, for mentioning that. United Healthcare, they have I don't even know how to say that, Sanvelo app that's free for everyone. And I'm not sure what that is, even a limited version for non-members. There are insurance companies that have wellness programs. It's a mental health app. Okay, awesome. Yeah, there's insurance companies that have that have like wellness parts to it. And that's part of that like proactive piece and that supportive piece. Ray says, we also have United Healthcare, and they have Rally, which is a health and wellness that employees can engage in by attending 1.5 hour meetings on a weekly basis. And I love those things. And I want hopefully you guys to help increase some of that engagement is by talking about these options. If you have an employee that comes to you and is struggling, you can, suggest they do something like this. And then also do it yourself. Even if you don't necessarily need it, it can just be helpful. You're going to learn more. You're going to learn more about yourself, and you're going to learn more about ways to support others as well. Okay, any other questions? Want to make sure that we get everything. Okay, and just again, I really appreciate, oh, Joseph said something. What happens when trust is eroded again and again, and every effort is done to deconstruct others? That's where we have to draw our own boundaries. We have to say, you know what, I can't be supported by this person, or I can't support this person, whatever it is, where that trust has been eroded again and again. That's where we have to say what's going to be in the best interest for me, or what's going to be in the best interest for this person, and put those boundaries in place where we kind of draw those lines. So thank you again. I'm from Nivati. We are a platform for your body and mind. I have Amelia's and my email address for contact. If you do have any questions for us, please feel free. That's everything. I'll turn it back over to hr.com.
Thank you, Hayley. This concludes our webcast today. I would like to thank our presenter as well as all of you for joining us. If you joined late and would like to view this webcast again, the recording and slides will be available in the hr.com archives. Your HRCI credit will appear in your account within 2 business days. We also send out an email with the credit information. Please take a few moments and fill out the webcast survey that will open on your screen. Your feedback is very important to us. This concludes our webcast. Enjoy the rest of the event.